Subscribe now for your regular dose of Asian health information.
So shoulder pain is a fairly common problem. I would say that all individuals at some point in their lives will suffer from shoulder pain, and the statistics is about 40% of individuals do get shoulder pain at some point in their lifetime. So I see a variety of shoulder problems. They range from patients just having pain to those having issues with stability of the shoulder, what we call shoulder instability, to those even having stiffness of the shoulder, what is commonly called frozen shoulder. And of course, I also see problems such as wear and tear problems of the shoulder, and we call that shoulder arthritis. So this work from home period has been a very interesting period for patients and people working out of their offices from home. A lot of it is due to the posture in which they sit at home. So I have definitely seen an increase in the number of neck pain and shoulder pain in some of these patients. A lot of it is due to maintaining the same posture throughout the period of work. Some of them sit in front of their computers to work for like 8 to 10 hours consecutively, and that leads to a lot of strain and tension in the muscle, and they develop a lot of pain along the way. So the recommendation is that if you are working for many hours at a stretch in front of your computer or your workstation at home, it's recommended to wake up and get up every 5 to 10 minutes after a period of 30 minutes of working to do some stretches and to walk around so that your muscles are not used to the same position and the same tension over a long period of time. Commonly also see shoulder pain in individuals who do a lot of heavy workouts involving the shoulder. For example, those who do a lot of lifting at the gym, I do find that they tend to put too much stresses and loads through their shoulder joints. As a result, that they can get muscle strain and tendon inflammations, what we call tendonitis. Also those who are involved in certain type of sports, like for example throwing sports, such as baseball, softball, javelin throwers, they also tend to get shoulder problems from repetitive strain of the shoulder. So the shoulder can hurt when you're working for long hours at your desk station because of the position in which your shoulder is. For a lot of us, when you sit for 8 to 10 hours in front of the computer or in front of your desk, what happens, the shoulder is drooping forward too much. And that leads to an imbalance of the muscles around the shoulder. As a result, that some of the muscles are working more or put on a more longer stretch compared to other muscles. As a result of that, you can get certain muscles being overloaded and you can get pain coming from these positions. So people tend to put their shoulder through repetitive movement when they engage in certain types of sports. For example, tennis players who do a lot of serves and overhead serves, they tend to raise their shoulder above the level of their head. As a result of that, they get a lot of strain of certain muscles and tendons around the shoulder. Also those in the gym who do a lot of overhead lifts or overhead pull downs, like for example the latissimus pull down in the gym, they also tend to raise their arms higher, and as a result of that, they may suffer from impingement or pressure on tendons in the shoulder joint. So certain activities and certain sports tend to trigger this if it's done on a repetitive basis. So normally you recommend a period of rest to allow these shoulder pains to get better. So for most patients who are doing repetitive strain of the shoulder, we tell them to enforce a period of rest for about 3 to 4 weeks to see whether they recover from the pain. Besides rest, we also ask these patients to work with a physical therapist to do lots of stretches and strengthening for these muscles and tendons to try and relieve the pain from the tendons and the shoulder. Analgesia also has a role, so if the pain is very significant, then they can take oral analgesia to try and reduce the pain. And very special circumstances, if the patient is not getting sufficient relief from analgesia or the physical therapy, one other modality or treatment that we can offer patients is a steroid injection into the shoulder joint around the tendons to try and reduce some of the inflammation. Diagnosis of shoulder problems usually starts by getting a good history from the patient. So I usually ask them a lot of background about their problem, how long they had it, has there been any injury to the shoulder, in what way does the pain limit them or stop them from doing the things that they want to do. Following getting a history, I would then do a physical examination to check the range of motion of the shoulder as well as the strength of the shoulder joint. That gives me an idea of which tendons are involved and what the limitations are. And then to clinch a final diagnosis, I would recommend getting an investigation on the shoulder, such as an X-ray or an MRI scan. or in some situation an ultrasound scan. And usually by that time we can get a proper diagnosis of the patient and be able to tell them exactly what problem they have. So there's a variety of treatment modalities for patients with shoulder pain that we offer in our clinic. The most common form of treatment that most patients require is physical therapy. In addition to physical therapy, I usually put a lot of them on analgesia or anti-inflammatory medication to reduce the pain as well. If a patient doesn't respond to anti-inflammatory medication or physical therapy, the other treatment of choice would be doing an injection to the shoulder. There are two types of injections that are fairly common. One is a steroid injection, which is mixed in with a local anesthetic. The local anesthetic brings about pain relief, and the steroid reduces the inflammation within the shoulder. The other form of injection, which is getting fairly common these days, is what we call platelet-rich plasma injection, or PRP injection for short. In this particular injection, we extract the patient's blood, we spin it down in a centrifuge machine, we get the cell type called the platelets, a high concentration of it, and we inject it around the tendon to stimulate healing of the tendon. And this is becoming fairly popular these days. Now, if the patient has got structural damage inside the joint, for example, say they had a torn tendon or a torn labrum, then these structures will require surgical attention. So I would say in about 10 and 20% of my shoulder patients who come and see me with shoulder pain and shoulder problems, they might require surgical attention to get these tissues repaired. These days, almost all of these repairs are done through a keyhole method, or minimally invasive, or what we call an arthroscopic method of getting it repaired.
Subscribe now for your regular dose of Asian health information.